I'm Elizabeth Messenger. I'm the Director of Outreach and Education here at NeedyMeds. So just a little bit about today's speakers. I already mentioned myself. I will be spending a little bit of time towards the end of the webinar talking about NeedyMeds and how we can help. But let's talk a little bit about the people from the National Psoriasis Foundation. Sarah Kaufman is the Advocacy Outreach Manager at the National Psoriasis Foundation, where she manages grassroots advocacy volunteers and activities related to government relations at the federal and state level. As part of the advocacy team at the Psoriasis Foundation, Ms. Kaufman works to improve insurance coverage and access to treatments for people with psoriatic disease. She's based out of the organization's headquarters in Portland, Oregon. We have Kathleen Carter, who's the Outreach Coordinator and Health Educator from the National Psoriasis Foundation. She works one-on-one with patients to answer questions about disease, treatment, and access. Ms. Carter assists in the development of the Foundation's educational resources, including booklets and webinars, in addition to managing peer support programs and volunteer opportunities, and she's also in Portland. Finally, we have Neva Haynes, and she's the Health Policy Manager for the National Psoriasis Foundation. She works on access to care issues with insurers on the state and federal level, legislative and regulatory policy. She's worked on public policy and advocacy for the last decade, and she's based in Washington, D.C. So we're really excited here at NeedyMeds to have three really great representatives from the National Psoriasis Foundation. Our organizations have partnered together in the past, and we're excited to be able to present this webinar. So Sarah, would you like to take it away for us?
Sure, thank you. Thanks, Elizabeth. That was for the very warm welcome. Thank you. So on behalf of the National Psoriasis Foundation and my colleagues, Neva and Kathleen, we're really pleased to be here and with this opportunity to collaborate with NeedyMeds and with Elizabeth. This is such an important issue for so many people living with psoriasis and psoriatic arthritis. Being able to access needed treatments and medication is really a key aspect in living a healthy and productive life when affected by psoriatic disease. And today, it is really our hope that this webcast will provide those of you listening with tips and tools to access the treatments prescribed by your healthcare providers in fair and affordable ways. And at a very minimum, we sincerely hope that you will consider the National Psoriasis Foundation and NeedyMeds a resource and a partner as you look for treatment options to live a functional and healthy life. So today our agenda is pretty straightforward. Since we have a wide range of attendees on the webcast today, from the newly diagnosed to longtime National Psoriasis Foundation volunteers and advocates, we want to make sure that we cover some basic information about the diseases of psoriasis and psoriatic arthritis. And we also would like to be able to cover a range of the treatment options that exist for these diseases, as well as the comorbid conditions that really affect many people living with these diseases. Throughout the webcast, we will provide you with tips and tools to navigate and troubleshoot some very common insurance issues and barriers that people face. Additionally, we'll provide you with resources that have helped many people access the treatments that they need in fair and affordable ways. And we also want to share with you some of the priorities within the National Psoriasis Foundation that work to break down barriers to care for people with psoriasis and psoriatic arthritis, and priorities that we believe will advance our population towards better treatment options and eventually a cure for these devastating diseases. Next slide, please. A little bit about the National Psoriasis Foundation. The National Psoriasis Foundation is the world's largest nonprofit psoriasis patient advocacy organization, and the foundation assists approximately 1.5 million people annually through our educational programs, events, and services that we provide throughout the nation. And our hope is that the NPF can really be the voice for the 7.5 million Americans who are affected by psoriasis and psoriatic arthritis. Our mission, and really the reason the National Psoriasis Foundation exists, is to find a cure for psoriasis and psoriatic arthritis and to eliminate their devastating effects through research, advocacy, and education. And this mission can't be accomplished without help. It's not something that the foundation can do alone. And so the foundation engages thousands of volunteers around the country in activities that will lead to a cure. And we sincerely believe that every single voice counts. The more voices that join this cause to find a cure and better treatment options, the quicker we can accomplish our mission. Next slide. So access to treatments is really a priority for the National Psoriasis Foundation. The National Psoriasis Foundation maintains a very strong commitment to supporting public policies and programs that help achieve a cure, make progress towards better treatments, and what we're going to touch on today, we want to end insurance policies and procedures that are harmful to people with psoriasis and psoriatic arthritis. A little bit about our advocacy program. The National Psoriasis Foundation is working with health insurers, government entities, and individuals at the federal, state, and local level to reverse trends that inhibit access to care, and to really make sure that the full range of medically necessary treatment options are accessible through a timely and fair process. Within our advocacy department, we aim to make sure that when your medical provider prescribes a treatment regimen, you will have access to it. More specifically, our advocacy team at the National Psoriasis Foundation works to shape laws and policies that affect people with psoriasis and psoriatic arthritis. And again, we do this harnessing the collective efforts of thousands of advocates. And together, when advocates raise their voice along with the advocacy department at the National Psoriasis Foundation, we work to make insurance fair and affordable, and we work to improve the safety and affordability of psoriasis treatments, and also to increase federal funding for psoriasis and psoriatic arthritis research. And we do this in order to find better treatment options and eventually a cure. At the completion of this webinar, we would strongly encourage you to raise your voice and get involved with the advocacy and the outreach initiatives at the National Psoriasis Foundation if you aren't already involved. You can simply visit us at psoriasis.org to learn more and visit the advocacy section. There you can sign up to receive action alerts on issues of importance to the psoriasis community. We truly believe that advocacy is empowering. Your voice can make a difference for the millions, for you and for the millions living with psoriasis and psoriatic arthritis. So we strongly encourage you to get involved and join the cause. So next I'll go ahead and turn it over to Kathleen, who shall talk a little bit about psoriasis and psoriatic arthritis and available treatment options.
Thank you so much, Sarah. Hello, everyone. I'm so pleased to be here today. And as Sarah mentioned, I'm going to speak a little bit about psoriasis, psoriatic arthritis, and the prevalent treatment modalities, and what's involved for a patient in terms of accessing these treatments. So as many of you may already be aware, psoriasis is a chronic lifelong disease of the immune system. It is not contagious, and no one knows exactly what causes psoriasis, but the immune system and genetics play major roles in its development. Actually, up to about 10% of the population may have a genetic predisposition for psoriasis, but only 2 to 3% actually end up developing the condition. And that's because each individual has to receive the right mix of genes and experience a particular individual environmental trigger in order for psoriasis to appear. So as you can see in this model, psoriasis flares occur when the immune system is mistakenly triggered, which speeds up the growth cycle of skin cells. So a normal skin cell would mature and fall off the body's surface naturally in the course of about 28 to 30 days. But a psoriatic skin cell only takes 3 to 4 days to mature, which causes skin cells to pile up on the surface, creating silvery gray scales or lesions that are associated with plaque psoriasis. Psoriasis is highly prevalent in the U.S., and it occurs all throughout the world. It affects men and women in roughly equal proportions and is present in all ethnicities, though in varying rates. Next slide, please. Psoriatic arthritis is a chronic inflammatory disease of the joints and connective tissue. It is linked with psoriasis on the skin, so up to about 30% of folks with psoriasis will develop this inflammatory type of arthritis, on average about 10 years after the onset of their skin symptoms. About 85% of patients experience skin psoriasis prior to developing psoriatic arthritis, but everyone is different. And there's a wide range of symptoms associated with this type of arthritis: stiffness, pain, and swelling in and around the joints, generalized fatigue, nail changes, and prolonged stiffness in the morning. Early recognition and treatment is critical for disease management here, because unlike psoriasis, psoriatic arthritis is a progressive condition which can cause irreversible joint damage if it's not properly treated. Next slide, please. So the newest available research indicates that the processes of chronic inflammation associated with psoriatic disease can actually lead to other very serious health risks. Accounting for all other variables, people with psoriasis and psoriatic arthritis are at an increased risk of developing comorbidities, which we'll discuss on the next slide. Our constituents may be familiar with an imaging study conducted by Dr. Nehal Mehta at the National Institutes of Health. Dr. Mehta, who is a cardiologist, used FDG PET CT scanning to show inflammation in psoriasis patients. And that occurred not only on the skin and joints, but also on the liver and in the walls of the aorta and arteries. So clearly this is a condition that's more than skin deep. Next slide, please. Here you can see some of the conditions associated with the incidence of psoriatic disease. Cancer, both squamous cell carcinoma and lymphoma, which is a cancer that affects the immune system, have been linked with psoriasis and psoriatic arthritis. Heart disease, as I mentioned, research indicates psoriasis may lead to inflammation in major arteries. Crohn's disease, which is a immune-mediated inflammatory bowel disease. Diabetes as well. Psoriasis patients are at an increased risk of developing the cluster of syndrome, and that includes obesity, abnormal blood cholesterol levels, high blood pressure, and diabetes or insulin resistance. Old age as well as greater severity of psoriasis can complicate or increase these risk factors. And in one study, those with severe psoriasis were actually 46% more likely to have type 2 diabetes. Depression as well, people with psoriasis are actually twice as likely to become depressed as the rest of the population. Doctors actually believe that the biological changes that cause psoriasis may also cause depression, and certainly the stigma associated with visible psoriasis can also make people depressed. Next slide. Oh, actually, let's stay here for a second. So next we're going to discuss some of the common treatment modalities for psoriatic disease. A couple of things to note at the outset. There is no single treatment that works well for everyone. And as an organization, we're really trying to promote awareness and education around all of the treatment options that do exist and help to facilitate and empower patients alongside their healthcare provider to make the choice that's right for them. There's not a one-size-fits-all type of approach to treating these conditions. Switching treatments is absolutely common. So a particular treatment that worked well in the past can stop eliciting positive results over time. And because of this, combination treatment plans, rotational treatment plans are used quite frequently. And as with any chronic disease, it's really important for patients to take an active role in their care and for them to find a specialist that's knowledgeable and invested in creating a long-term treatment plan. Next slide, please. So there are three primary treatment modalities for psoriasis. They're topicals, phototherapy, and systemic medications. The first one we'll talk about up here is topical treatments. Topical treatments, which are medications that are applied to the skin, are usually the first line of defense in treating psoriasis. Especially for a mild or localized case, a healthcare provider will typically go to a topical treatment first. Enrolling is an older topical treatment, somewhat hard to get a hold of these days. There are also vitamin D analogs, which are comprised of a synthetic form of vitamin D. They come in a range of different consistencies, from creams to ointments to scalp solutions. Retinoids, which are vitamin A derivatives. Topical corticosteroids, definitely the most frequently used treatment for psoriasis. Steroids are referred to as anti-inflammatory agents because they reduce the swelling and redness of lesions. They come in a range of strengths, so class 7 being super potent, down to very weak steroids as well. But generally speaking, the stronger the steroid, the more effective it is in clearing psoriasis, but the risk of side effects is also greater. I should also mention that there are a large number of over-the-counter topical products that can help to treat psoriasis, especially mild symptoms. So anything from moisturizers to coal tar ointments to shampoos can be helpful in offering symptomatic relief. Next slide, please. So if a topical does not work, or if the psoriasis is more severe, a healthcare provider would probably turn to one of these options instead: phototherapy or systemic medication. Phototherapy, it's also sometimes called light therapy, involves exposing the skin to wavelengths of ultraviolet light under medical supervision. The treatments typically take place in a doctor's office or psoriasis clinic. There are two types of ultraviolet light that are primarily used in the therapeutic setting, UVA and UVB. UVB is more extensively used, and the newer iteration of that, called narrowband UVB, releases a smaller range of ultraviolet light. It's administered about 3 times a week, and typically you see optimal results after about 30 treatments. UV light A is also sometimes used, but it has to be coupled with a photosensitizing drug called Psoralen, where the therapy earns its name, Psoralen plus UVA. It can be very effective and produce long remission times, but this type of treatment is associated with a higher risk of skin cancer than UVB treatment, potentially including more dangerous and aggressive forms of skin cancer like melanoma. Phototherapy can be administered by a whole bunch of different types and sizes of equipment. Some are large full-body panels. There are also handheld units, boxes just for the hands and feet, or UV wands for the scalp. There are also home units available for purchase, which would be an appropriate option for someone who's experienced in receiving phototherapy treatments but is unable to make a trip to the doctor's office several times a week. Systemic treatment options are another option for patients with more severe psoriasis. Systemic options basically work from the inside out to combat the inflammatory process of psoriasis. Cyclosporine is an immunosuppressive drug. It's taken by mouth. It's typically considered a rescue sort of treatment. It works quite quickly, but there are limits on the amount of time it can be taken consecutively and during a person's lifetime. Methotrexate is an immunosuppressive drug taken widely for psoriasis. It's sold as a generic, so it's easy to access and affordable. Soriatane is an oral retinoid, which is a synthetic form of vitamin A. It tends to work slowly for plaque psoriasis, but it can be quite effective when it's coupled with phototherapy. Next slide, please. So biologics are the newest class of systemic medications for psoriasis and psoriatic arthritis. They are delivered either by injection into the skin or muscle or by IV infusion. Biologic, as a term, refers to a drug that's derived from a living source, like a human or animal protein. A vaccine is an example of a biologic drug. While some of the older treatment options, like methotrexate that we mentioned, impact the immune system as a whole, these types of biologics are more sophisticated and targeted in their approach. They act by blocking the action of certain immune cells or chemical messengers that play a role in psoriatic disease. Enrolling, Humira, and Remicade are medications called TNF-alpha blockers, which target tumor necrosis factor alpha. TNF-alpha is a cytokine that causes cells to release other proteins that add to the inflammatory process. And Stelara is an injectable interleukin-12/23 blocker. And IL-12/23, these are cytokines that mediate inflammation. Biologic medications are designed to be taken continuously to maintain the improvement. These medications can be extremely expensive, and without insurance, sometimes the cost of these drugs can run well over $20,000 a year. Next slide, please. There are two primary treatment modalities for psoriatic arthritis. The first is nonsteroidal anti-inflammatory drugs, which help to relieve the pain, swelling, and stiffness of psoriatic arthritis. There are many, many options in this regard, including both prescription and over-the-counter medications. An NSAID would be most appropriate for someone with mild psoriasis that maybe only limitedly impacts a small number of joints. For somebody with a more severe form of psoriatic arthritis, a more serious prognosis, they would probably be looking to a disease-modifying anti-rheumatic drug instead. DMARDs actually attempt to slow or stop the joint damage and progression of psoriatic arthritis. These types of medications include methotrexate, sulfasalazine, some anti-malarial medications that are often used for arthritis. Next slide, please. So biologic drugs would also be considered DMARDs. And here's a list of the biologics currently approved for psoriatic arthritis. As you can see, there's considerable overlap here between this list and the list of medications approved to treat psoriasis. the exception being Symphony, which is a injectable TNF-alpha blocker. We do expect this list to grow as early as this fall, with additional medications being approved to treat psoriatic arthritis. Next slide, please. So before we conclude this section of the presentation, I just want to take a look at the bigger picture for some of the impacts of psoriasis and psoriatic arthritis for the patient. Comorbidities, this is something we discussed a bit earlier. One of the important takeaways here is that there could be substantial consequences for choosing not to treat psoriasis or psoriatic arthritis, being unable to treat psoriasis or psoriatic arthritis, especially a more severe occurrence. There's a substantial emotional burden for visible and chronic and often misunderstood conditions. Economic burden scaled all the way from whether your treatment is topicals to a biologic. These conditions can be extremely expensive to deal with and to treat. And I'll now hand the presentation over to Neva, who will discuss tips and tactics for overcoming barriers to treatment.
Okay, thank you, Kathleen. Hi, everyone. So today I'm going to provide you with an overview of exactly what you can do when you're faced with an issue that's impeding access to care for you or a loved one. Next slide, please. So what you see on this slide are the steps that you should take no matter what issue you're facing. The first bullet point in course of action is to identify the issue, and here you want to be as specific as possible. Being specific in identifying the issue will help you to craft a plan and find a resolution. For example, you might go to the pharmacy counter to fill your prescription and find out that it is not covered by your plan. So there are a lot of sub-issues there, such as how your healthcare provider, insurance company, and pharmacy communicate with each other. But your issue that you want to focus on, that you may be able to resolve, is that your treatment is not being covered. So the second thing you want to do is you want to figure out who is responsible for the issue, and sometimes this can be difficult to pinpoint. If you're having difficulty, the NPF is here to provide one-on-one assistance through all of these steps. The Psoriasis Foundation has many resources and tools available, and I'm going to go over some of those today. After you identify the resources and tools, you want to polish your message. If you're writing a letter, have a friend or a loved one give you feedback on your messaging. And again, the NPF is here to help you. And you want to find partners. Who else might the issue be affecting? Who else might be interested in the issue? And finally, don't stop telling your story until you find a resolution. Use every available outlet to tell your story. And the Psoriasis Foundation, we're happy to work with you through the process and make sure that your story and your voice is heard. Next slide, please. So on the screen now, you should see a list of the most common problems that the Psoriasis Foundation hears about from people that are having trouble trying to access care. The top issues are high out-of-pocket costs, being uninsured, being insured but facing a denial of coverage for a treatment or procedure, and last but not least, step therapy or fail-first policies, where patients are being forced to go through too many steps to access their prescribed treatments. So now I'm going to go over what you can do if you find yourself in one of these circumstances. Next slide, please. So when you're faced with an insurance denial, and this can include being forced by your insurer to go back through the step process, here are a couple of the steps that you can take to appeal that denial. So after you've received the denial, you should first ask your doctor to write a letter of medical necessity. This letter should include information on your treatment history, any treatments that you've tried and failed, and any relevant comorbid conditions. At the link at the bottom of this screen, we have template letters that both you and your doctor can use to write letters to your insurer. We also encourage you to reach out to your state insurance commissioner, and we have a template letter on our site that you can also use to do that. If you're employed and you receive coverage through a spouse, parent, or other family member that is employed, we encourage you to contact the HR department of that company. Most HR professionals work to ensure that the coverage that's being offered by their companies is meaningful and that it meets the employee's needs. So HR may be willing to negotiate with the plan on your behalf, or they might be helpful in finding a better plan option to meet the employee's needs. Again, you might want to consider changing plans. And here again, we encourage you to contact the NPF if you need any more information about any of these steps. Next slide, please. So sometimes your insurer might approve your treatment, but your copay or your coinsurance costs might be very high. We've heard from patients that were asked to pay copays or coinsurances of up to $1,000 per month. That's on top of a premium, on top of deductibles. And for many families, that's simply unaffordable. So on this slide are some of the things that you can do to lower your out-of-pocket costs. On psoriasis.org, at the link at the bottom of this slide, we have a list of manufacturer assistance programs and information on patient assistance programs. The Psoriasis Foundation is happy to help you identify which programs are the right fit for you. We don't endorse any particular treatment. Our mission is just to help you find the resources to afford your care. Medicare beneficiaries might be eligible for the Extra Help program offered by the Social Security Administration. And this program in particular is intended to help Medicare beneficiaries afford drug coverage. More information is available on the Access to Care section of our website and also from the Social Security Administration. For those with employer-sponsored coverage, you may again want to consider reaching out to your HR department and sharing with them just how unaffordable your treatment costs are. They may be willing to look for better coverage for the next open enrollment period. And again, please don't hesitate to contact the NPS if you need any more information or assistance going through these steps. Next slide, please. And also, many people are uninsured or at some point become uninsured. So this slide is an overview of what you should know if you are currently uninsured or ever become uninsured. The first thing is that per federal law, starting in 2014, health insurance plans can't refuse to cover you or charge you more because you have a pre-existing health condition. And beginning October 1st, all individuals will be able to find coverage and enroll through state insurance marketplaces, where subsidies may be available to help cover the cost of your premium. These subsidies are based on your income and are calculated by the IRS. Again, please don't hesitate to contact the NPF if you need more information about that. Next slide, please. Many patients also try and fail many treatments, and sometimes there is not a treatment that works or there is no appropriate treatment that's currently approved. We want to share as an option some of the reasons that people decide to enroll in a clinical trial. This can include access to treatment that is not yet available on the market, access to free medication and other forms of compensation, and also the satisfaction of helping to advance medical research. Next slide, please. So on the screen now is a screenshot of the homepage of psoriasis.org. As you'll see, if you put your mouse over the research heading, a blue box pops up on our homepage with information on psoriasis and psoriatic arthritis clinical trials by state. We sometimes get questions on how to find clinical trials, and so we wanted to share this resource with you today. And now I'm going to turn things over to Elizabeth, who's going to talk to you about some of the really great resources that are available through NeedyMeds. Elizabeth?
Thank you so much, Neva. Yep, right now we're just going to do a very basic overview of NeedyMeds and how our resources can help people with psoriasis who are struggling to afford their medications and healthcare costs. I also did want to take this time to remind you that if you are having any questions or there's something you want us to go back to or we're not covering completely, please go ahead and type them into your questions bar in your control panel at any time, and we will answer questions that we can get to at the end. So our mission at NeedyMeds is to help you find help with the cost of medications and healthcare. In a little more detail, it's to provide free access to accurate, comprehensive, and up-to-date information about programs that help people afford their medication and healthcare costs. So we are a national nonprofit organization founded in 1997 by our current president, Dr. Sagel, and a medical social worker. All of the information available on our website, NeedyMeds.org, is free, easy to access, and updated regularly. You can also update it anonymously. One of the really important things to us is that our information stay up to date. The majority of our staff does spend their time making sure all of our information is accurate for those who use it. So this is just a quick snapshot of our homepage. In general, if you go to our website, NeedyMeds.org, you're going to be going down the left-hand side there where it says Patient Assistance Programs, and going down there, that has all of our major categories of information, which we'll just go over briefly now. So the patient assistance programs run by the pharmaceutical companies, I think, have already sort of been referenced quickly during this presentation. Just a little bit more detail about how those programs work. They're usually sponsored by the companies, and they'll provide free or discounted medications to low or moderate income people who are uninsured or underinsured, who meet certain guidelines. Sometimes it's even for people who do have insurance. There's no rules when it comes to the PAPs, as we call them for short. Each program can kind of set them up however they want. Eligibility is going to vary. Applications, each program has a different application. So it can get a little confusing, a little overwhelming. We try to make it really easy for you on our website. You can go on our website, look up a medication you're taking by clicking on the brand name drugs or generic name drugs link, see if there's a program available. You want to think of NeedyMeds as sort of like the yellow pages for all different kinds of programs and resources that can help you. We provide you the information. We try to connect you to the programs. One thing to keep in mind if you are thinking about trying to get enrolled in a patient assistance program is your healthcare provider will need to be involved. These programs are for prescription medications, so usually they need to at least provide the prescription. Most of the time they also need to sign the application as well. So the patient assistance programs is the part of our website that probably gets visited the most and that people know about NeedyMeds for. That's how we're known. But we do have a lot of other information on our website that can be helpful. Our diagnosis-based assistance program is probably one of the other most helpful parts of our website, because these programs will help you not just with the cost of medications, but all those other costs of healthcare you might be struggling with, whether it's treatment, supplies, travel, even general living expenses. You may be able to find assistance. So you can actually click on this section of our website. You could look up psoriasis and see if there's a program available that might be able to help you. We have a section on our website called Coupons, Rebates, and More. I just wanted to highlight this section because this is where we list, as well as general coupons and rebates and things like that, we also list the pharmaceutical company copay cards here. Now, these copay cards have been coming out a lot recently by the companies, and they can be very helpful if you do have insurance. Sometimes they'll save you hundreds of dollars a year off the cost of your medications. So that's the section of our website. You'd want to look for that. And the medications will be listed alphabetically, so you can see if there's a copay card or just a regular coupon available for your medication. We'll also list coupons for over-the-counter medications here, so it's a good place to look if you maybe need help affording an over-the-counter medication as well. Just some other resources on our website. We're not even covering everything. We do have a lot of information on our website, so I'd encourage you to kind of go back and look at it on your own. But a few other things to highlight. We have a list of over 12,000 free or low-cost clinics. So if you are looking for some lower-cost medical care, you can plug in your zip code and find facilities nearby to you that are either free or low cost, or possibly reduce your cost based on your income, like with a sliding scale. So those will include free clinics and federally qualified health centers, as well as just other facilities that will discount their prices based on someone's income. We have a list of camps, retreats, and scholarships, also offered based on a diagnosis that you can look up. We also have government programs listed on our website, which is going to include the state programs as well as the government programs, things like ship sites and things like that. So a great place to start on the NeedyMeds website, if you've never been to it before, you kind of quickly want to see all the help that we know about available for people who have psoriasis. You can actually go to our psoriasis resource page. We have a section on our website called Disease Resource Pages, and we work with other nonprofit groups on these pages, and we partnered with the National Psoriasis Foundation actually years ago on this page. So you can go there and quickly kind of find links to different parts of our website that may be able to help you. So I'm going to we have a little screenshot. I know this is really small, but you can always go back and look at it later. But you can see in the middle we have medications someone might be taking who have psoriasis. The ones in blue will actually link to whatever patient assistance program we know that's available. The bottom is going to link you to some diagnosis-based assistance programs might be able to help you. The left-hand side is actually going to link you back to the National Psoriasis Foundation website for more information. So this is a really good place to start on the NeedyMeds website just to quickly find out about kind of all the help we know about. The last thing I'm going to talk about is our drug discount card. I know this is a lot of information, but we're just doing a quick overview, and you can always ask questions or email us if you have any questions about NeedyMeds. So in addition to the information we list on our website, we do have a free drug discount card we offer as well, just as an additional resource for people who maybe can't get enrolled in a program, need some quicker assistance. It's a free card that can save up to 80% off the cost of prescription medications, over-the-counter medical supplies written as a prescription, and pet prescriptions purchased at a pharmacy. You don't need to activate it or register, and there's no guidelines, and it's also accepted at over 63,000 pharmacies across the country, including all of the major chains. The basics when it comes to the card is it can't be used in combination with insurance. So, of course, someone who is uninsured could use it, but if someone had any type of insurance, whether public or private, they could use it for those things not covered under their insurance, maybe if they're in a coverage gap, have a very high copay, they can use the card instead. So you can go to your pharmacy and say, I want to process my medication through the card instead of through my insurance. So again, it's really helpful for the things not covered, or if you do hit a coverage gap. It's also helpful on those over-the-counters you might need help with. If your doctor wants you to regularly take some sort of over-the-counter or use some sort of gel, if the doctor writes it as a prescription on the prescription pad, you can use the card to get a discount, and the savings are up to 80%, on average about 45% off the cash price. So just a quick review of what we talked about today, sort of when you're maybe helping a family member, you're thinking through yourself what kind of help you can get using our website. I always say look for a patient assistance program first if you do need help with the cost of medications, because getting your medications for free is always your best bet. You can try using the NeedyMeds drug discount card as well, and you can always, you'll have contact information, so you can always email us. We send out free cards all the time. We also have a downloadable version of that card you can print and use from our website that's just as good as a plastic card. If there was no patient assistance program, maybe you needed some quicker assistance, help on over-the-counter or copay, check the coupons, rebates, and more section. And maybe if there was no patient assistance program, or maybe you needed help not on a medication, but something else associated with your diagnosis, you could look at our diagnosis-based assistance section. So that's our contact information. The info at needymeds.org is checked regularly, so you can email that. If you have any questions, you want to request a discount card. We also do have a helpline number you can call. This is for folks who maybe aren't comfortable using the internet, are a little bit confused on our website. Someone from our call center will sort of either explain how to use our website or ask what kind of help they need and provide some phone numbers and assistance. So we also have the National Psoriasis Foundation contact information if you have questions or you need help obtaining financial assistance. You can also call them, an NPF health educator, at 800-723-9166, or email them at education@psoriasis.org. So with that, we've come to the end of our part of the webinar, so we would definitely love to answer any questions that you have. I'm just going to start reading through what you typed in so far. Feel free to type in some more after. I do also want to mention that there's going to be a survey that's going to pop up at the end of the webinar. So it would be great if you could fill that out at the end of the webinar. So let's start looking at the questions. This is a good one for either any of the Psoriasis Foundation representatives. Is there a good patient decision aid for psoriasis patients?
I'll take that one. This is Kathleen. That's a great question. There's not one in particular that we recommend. We do have a lot of different educational resources regarding all of these patients, or treatments, booklets, fact sheets about each of the medications, and also a list of questions on our website in the informed patient section, which will basically help you to get that discussion going with your healthcare provider. Think about everything involved in a particular treatment, from side effects to how often it's taken to what your costs will be with that. And all those resources put together will hopefully help to equip you in your decision-making process.
Thank you. Any other follow-up on that? Should we go to the next question? Okay. So there's a question just about where to find the discount card on the NeedyMeds website. You can just actually click on the little picture of the card on our homepage. That'll bring you to some information. You'll see a little place where you can download the card and print it out. This is a good one. Can we talk a little bit more about how the new health insurance law is going to affect psoriasis patients?
Hi, this is Neva. I'm happy to answer that question. So under the new health insurance law, which officially really goes into effect in January of next year, there will be plans that are available through state insurance marketplaces, as mentioned earlier. And one of the things that the Psoriasis Foundation has been really working on over the last several years since the Affordable Care Act passed is to make sure that those plans offer meaningful coverage for people with psoriasis and psoriatic arthritis, that the benefit packages actually provide meaningful coverage. So if you are interested in becoming more involved in that process, I would encourage you to reach out to the Psoriasis Foundation. Every plan is going to be different. So states basically set their benchmarks for coverage. And then, so there are 50 different benchmarks essentially. If you are having difficulty finding a plan in that process that provides meaningful coverage, we encourage you to reach out to us, or if you just need more information.
Thank you. Here's a good one. Do you feel that diet has any effect on psoriasis symptoms?
This is Kathleen. I can take that question. It's one that we get a lot, and I think the answer is absolutely, but not for everyone. And you know, it's certainly important with psoriasis and psoriatic arthritis disease management to spend some time thinking about what your individual triggers might be, and they really are specific to the individual. So a medication or something in someone's diet may have a large impact on one person, but it might not affect another person at all. So you know, spend some time thinking about whether there are things in your diet that could impact your symptoms. A lot of people with psoriasis tell us that gluten has some impact and flares them up, but again, not the case for everyone. So one thing that can be really helpful as you're trying to figure that out is doing some journaling about your symptoms. So if you're able to document your ups and downs, it can help to kind of track those triggers. And getting a good handle on your triggers is really important to managing your disease in affordable ways. So if you're able to get your flares back under control, it can lead to less of a need for treatment.
Follow-up question to that regarding the triggers, do you think it would be beneficial to go to a nutritionist or an allergist to get tested?
This is Kathleen again. Yeah, it certainly could be. Again, there's sometimes, with the gluten example, again, you can test negative for a sensitivity, but still have some sort of reaction or sensitivity to gluten products. So absolutely, I think, you know, in any case where you're motivated to do a little bit more investigating about how psoriasis is impacting your body, by all means go for it, and just make sure that you're treating your healthcare team as a team as a whole. So make sure that your general practitioner and your dermatologist and your rheumatologist are all in the loop about what you're up to, any supplements you're taking, that sort of thing.
So there's a question about someone who has severe psoriasis only on their hand and sort of what you would suggest as far as participating in a research program. So maybe you could talk a little bit more about clinical trials and how that kind of works for people?
Sure, I can take that. Oh, go ahead, Neva.
You go ahead, Kathleen. Go ahead.
Okay. Well, fill in anything I missed. But so in terms of participating in a clinical trial, your experience, your directives, how often the medication is administered is really going to vary a whole lot depending on the phase of clinical trial that you're trying to get into. So just be aware that there's going to be a lot of differences. But do check out the clinical trials resources on our website for a list of options. There's contact information there for you to get in touch with the facilitators of these trials to learn a little bit more about what's involved. And with regards to psoriasis of the hands and feet in particular, we do have a number of great educational resources on our website, and you can email us at education@psoriasis.org for other resources. We actually had a webcast earlier this year about treating that particular form. Neva, is there anything you'd add to that?
Hi, I guess just add one additional thing. So a question or something that we commonly hear about as a concern with clinical trials is that people are concerned about receiving placebos and not actually being treated. So I just want to bring up on this call that the fear of receiving a placebo in a clinical trial, it's not really something that you should worry about. Clinical trials typically use either the standard of care of treatment, so whatever the standard treatment is, or the treatment that is being tested. So you're not going to receive no treatment. You'll receive either the standard of care or the treatment that is being tested. So that's all I wanted to add on to that.
Great.
Yeah, that's a great point, Neva. Thanks.
How about any Medicare-specific resources for people with psoriasis?
Sure. Well, Neva went over a couple. Oh, go ahead.
Okay. No, you go ahead, Kathleen. Go ahead.
Neva went over a few of these. Probably the first best resource that we refer folks to is some of those disease-based assistance funds. You can find a list on our website and also over at the NeedyMeds website. Some folks might be familiar with our organizations like the Health Well Foundation. There's a Medicare Extra Help program, again, listed on our website that can be quite helpful. And we also do recommend that folks still contact their pharmaceutical manufacturer. There's not a clear path for people with Medicare to receive assistance through a drug manufacturer, but sometimes on a case-by-case basis, you can find some help through the program that they have available for uninsured patients. So it's definitely worth a call, and do contact one of the health educators here if you're having any trouble finding contact information or resources specific to your medication.
Thank you. And I know from my experience at NeedyMeds, I would agree with you that whenever you're in doubt of whether you might qualify for a pharmaceutical program, you should always call and double check, because they do make hardship exceptions, and even if you don't necessarily fit into the official eligibility, it never can hurt to try and call. So I would definitely say you should do that, even maybe if they technically don't accept people with Medicare, or maybe you're right above the income guideline, always call and double check. And I also just wanted to mention something about the disease-based foundations, the Health Wells and Patient Advocates. Those are really helpful. You do want to keep in mind that they sort of open and close various funds. So maybe if you do call and the fund is closed, you can always call back, but you do just want to keep that in mind as the year is kind of progressing, that they kind of, depending on how much money they have, they open and close disease-specific funds. This is a great question. Any programs for family education to help them understand the needs of people who have psoriatic arthritis?
Yes, absolutely. Definitely get in touch with the education department here at the MPF. We have presentations, kind of Psoriasis 101, Psoriatic Arthritis 101 types of presentations that you can share with your family and friends. If you're interested in being a part of a community education event, we can send you booklets and fact sheets to help support you. So yeah, give us a call here, email us at education@psoriasis.org, tell us what you have in mind, and we can help you to get those resources.
Great, thank you. I think we're just coming up on at the end of time, so if you do have any more questions, you can certainly contact us at NeedyMeds or contact their Psoriasis Foundation. We'll be happy to answer some more questions. I do just want to mention, there's been a couple questions about this for folks who join later in the webinar. There will be a recording of this webinar available both on the Psoriasis Foundation and on the NeedyMeds website at these 2 links here. So hopefully in the next few days that'll be up, and you can always watch those recordings as well as previous NeedyMeds webinars and previous Psoriasis Foundation webcasts. And you can also email info@needymeds.org to get a copy of the slides, and we'll be happy to send those out to you. So we really appreciate here at NeedyMeds, and I'm sure the people from the National Psoriasis Foundation appreciate you joining us for this webinar. We hope it was really helpful to you. We were really happy to work with the National Psoriasis Foundation on this webinar and be able to present this information to everyone who uses our website and the people who interact with the National Psoriasis Foundation. I don't know if you wanted to say anything, ladies, before we ended the webinar.
Just a thank you to everyone for participating. Thanks, Elizabeth, for facilitating this. It's really been a pleasure.
Great, thank you so much. And we will try to get to some of the questions you typed in towards the end of the webinar. We'll try to send you out some emails, everyone. So I hope you all have a great rest of your day. And just a reminder that that survey will be popping up, so it would be great if you could fill that out. And thank you so much. Tune in for future webinars and future Psoriasis Foundation webcasts. Thank you.